Hello everyone, welcome to the Live Life podcast. I'm Layan. Today we are at the third edition of Forbes Middle East Healthcare Leaders Summit, and I'm joined by Mutasim Alireza, the CEO of Magharibi Hospitals and Centers Group. Thanks for being with us.
Thank you for having me, Layan. It's my pleasure.
Of course, we're always happy to have you. So, most of the healthcare industry nowadays are talking about longevity. So I would like to take your opinion about how you define longevity.
Well, I would define longevity as living a healthy life right to the end and being a productive person right to the last day.
That's, I think, a perfect definition of longevity. And today at one of the panels, you spoke about a proactive intervention. So can you tell us about some of these strategies that you implement or leverage at Magharibi and how these are helping in early detection and early diagnosis?
Yeah, I mean, there's many examples, but I'd like to talk about one particular example that we're planning to launch very soon. We're mainly in ophthalmology business, and diabetes is a major cause of ophthalmology diseases, especially diabetic retinopathy. And this is something that can be addressed and prevented if detected at an early stage. I mean, we get patients once they start seeing symptoms coming to us, and we treat them. Anybody who has diabetes should really be seeing an ophthalmologist at an early stage regularly to ensure that they don't develop diabetic retinopathy. We have been researching new AI-assisted applications, and we have tested one that is 90% accurate, and we're planning to launch it at the beginning of next year. In collaboration with a government institution and with a pharmaceutical company. And we have chosen a couple of major cities where we're going to launch that and give free examinations to people who walk in or people who would like to do that. And hopefully with that we'll be able to detect certain people who may end up getting it and end up helping them cure that. Once we have passed this stage and we've tested it, in the long run this program can become much bigger into a national program. We can have this program put in optical shops, in pharmacies across the kingdom, and we believe this will be a great initiative in preventing diabetic retinopathy in a region where diabetes is very high.
That sounds really interesting, and I really look forward to the launch of that project. And my second question is actually about how important is to educate patients or to do programs dedicated to educating patients about these topics, and what kind of initiatives do you have in this regard?
Without a doubt, education is probably the most important part of prevention. And nowadays, with the digital era, you can reach people much easier, and you can target people, and you can basically tailor messages to many sections of society that you want to address. The first thing is, within a group like ours, we have millions of medical records, and we know how to contact millions of people. With advanced digitization and with AI, we can segment the patients into different categories, those with diabetes, with age, with gender, and then we can basically target them directly through the different means that we have. Of course, another method is with media. Also with AI, you can target those types of people. Plus the traditional way of reaching people, which is still very effective, having messaging within our facility where we have thousands of people coming in and out, and different targeted messages in the different departments according to the different diseases. We also invite people to lectures in our sites, plus we go out and lecture across, and we visit schools and we visit malls and do free education and free examination, and we found this to be very effective. As I said this morning, I'm always surprised by the amount of people that actually attend these lectures and these events, and it's great. I mean, there are a lot of people who are interested to learn about prevention and these people in turn will end up hopefully educating their friends and families.
Absolutely. And as far as I know, you serve around 2 million patients annually when it comes to eye care, and you do 200,000 surgeries, site preserving surgeries annually. So that's a huge number, and a huge number of people actually putting trust into Maghribi. So can you tell us what sets Maghribi apart compared to other competitors that makes all of these people give their trust to the entity?
Thank you for the question. Maghribi is a 75-year-old organization. We didn't start yesterday. It was started by the late Dr. Amin Al-Maghribi, who was the first ophthalmologist in Saudi Arabia, and then followed by his son, Dr. Akif Al-Maghribi, who has set the vision for the future. And basically, unlike the other healthcare providers who turned into general hospitals, with Dr. Maghribi's passion and vision, he stuck with ophthalmology, and then we became subspecialized. So when you come to Maghribi, you don't actually go to an ophthalmologist, you are referred to a subspecialized ophthalmologist in that field. So when you go to Maghribi, you don't only see a qualified doctor, you also see a qualified doctor who has been overseen, his skills and capabilities have been overseen by our medical leadership. Then with the volume, then that really completes the qualification of the doctor. And obviously, because we are focused, we're not in many fields, we're always ensuring that we get the latest state-of-the-art technology and keeping up to date with that.
That's great. And also, as far as I know, you've been with Maghribi since 1997, which is a very long journey. And through this journey, the hospitals or the group grew up so much. So can you tell us, in your opinion, if you remember that journey, what was the greatest challenge, to expand, and how were you able to actually maintain these standards throughout this time?
Okay, I mean, my background is, before I joined Maghribi, I was in a healthcare management company that managed the King Khalid Eye Specialist Hospital. So I've been in ophthalmology before I joined Maghribi. And then when I joined Maghribi with Dr. Akif Al-Maghribi, who wanted to expand this, and he wanted myself with my management experience to help him grow it. And in reality, one of the reasons why we expanded is because people were actually asking for us all over the region. I mean, I didn't believe that when Dr. Maghribi first told me, but when I started seeing letters and phone calls for people asking for our services, and that's how the vision started. And we maintain our quality basically because we're focused. We're not opening general hospitals. So we know our business, we get qualified doctors, we monitor their capabilities. A lot of them come through our head office and do an orientation to ensure that their surgical skills are up to the standard. If not, they get to spend some more time to upgrade their skills. And then they are located in the different locations with privileges assigned by our medical leadership that will only allow them to do what they're capable of doing, and they take it from there.
Absolutely. And my last question is actually, we throughout this conference, we've spoken a lot about how there is pressure on the healthcare industry, especially now, like after COVID and after the pandemic. So in your opinion, what's the role of the private sector in actually supporting the healthcare system and the healthcare authorities?
Yes, that's a good question. I mean, there is pressure, and the government now are supporting the private sector and expecting the private sector to take up the slack more than ever before. In our case, we are probably the only specialized healthcare network managers as opposed to general hospitals, and what we have done to meet these demands, we've decided to go into other specialties other than ophthalmology because there is a high demand. For example, in dentistry, we got into dentistry and we intend to expand all over the region. We are also going to expand our ENT services. All these can basically fit within the type of network we are and the day surgery type. And we're currently also studying 1/4 specialty that we will also announce soon.
I'm looking forward absolutely to this announcement and knowing what's the fourth sector that you're getting into. Thank you so much for being with us today and for giving us all of these insights. Thank you.
Thank you, Layan. It's been a pleasure. Thank you.
Thank you.